So first of all, I would like to have Dr. Sara come on and talk to us and tell us what you are, what your whole mission is, what you love about your work, what are your greatest challenges, and what do we need to know? What is important that you think we all, men and women, need to know right now?
Yes, thank you so much, dear Linda, for having me. It's such a great introduction and for making the Zoom meeting with the distinguished guests. My really main mission in life is to save women from breast cancer. And this is what I've been trained to do through I acquired skills for surgery. So I practice oncoplastic breast surgery. And I specialize in this field because it is a very rare field and much needed because it keeps the cosmetic appearance of the breast while getting rid of the cancer at the same time. So previous to the oncoplastic breast surgery, a woman should have had a complete mastectomy where her breast is completely removed. And as you can understand, we all can imagine as women, that takes away from her feminine look, that takes away from how she looks at herself, how she dresses, and will affect her psychologically after she gets cured from the cancer, but she will live with the drama, with the scar. Now, with the oncoplastic breast surgery, things has moved. So nowadays, we do what we call skin-sparing mastectomy. So we remove completely the breast tissue and replace it with an implant. Something like the Angelina Jolie surgery. Everybody heard about Angelina Jolie and her story. And that actually has pushed women to come and ask for these type of surgeries and look for trained surgeons in that kind of field. What I do as well by establishing the one-stop breast clinic, as you said, when you had an experience yourself with a breast lump, waiting for the results can be as painful as knowing the news of being diagnosed with breast cancer. So minimizing the waiting time is very important, and you can do that. It's very easily to do. And I've learned this experience when I worked in the UK, something called the one-stop breast clinic. So within the same day, the woman would come into the clinic, she'll see the surgeon, she'll do the mammogram or the ultrasound and have the biopsy, and the result is told to her at the very same visit. This really reduces the shift from one clinic to another, like as opposed to she goes to the surgeon who refers her to a radiologist who then refers her to have a biopsy somewhere else and then comes back to see the surgeon at another appointment. All that time means an anxiety, means stress. Reducing that time can help you in several factors. First of all, you will get the diagnosis at an earlier stage because you're not even waiting for diagnosing the patient for some time, and therefore starting treatment early, planning the treatment and starting the treatment early. And then the third thing, obviously, reducing stress and anxiety for the patient. So this is the one-stop breast clinic that we do. As we know, the aim of today is October, which is the Breast Cancer Awareness Month. So internationally, the world is celebrating the survivors and encouraging women to come up for screening. So for those who have not had the screening during the year, this is a good reminder by wearing pink, running pink events, wearing the ribbon. All these kind of messages is to remind women to have their mammogram or their ultrasound done if they have not had it done throughout the year.
Thank you so much. Thank you, Dr. Sara. I appreciate the work that you're doing. And I think it's important because you are the expert. You are the one that we look to give us guidance. What would you tell us we need to know? There's just regular women in the world. What do we need to be aware of? What is important that you think we need to know? What do we need to do?
Yes, I will start from our different age group because we as women, our breast is different throughout our years. If we are in a different age group, so we remember ourselves, like when we first hit puberty, your breast feels and looks differently than when you are pregnant, than when you are close to your period, than when you are on your period, than when you are lactating, and then when you're menopausal, and then postmenopausal. So our normal breast normally goes through the routine normal changes, and that's the hormonal changes, and that is absolutely normal. We have to be acquainted with our own breast, so we have to practice breast self-examination, and this is mandatory for all women at all ages. So every woman should be able to touch her own breast, to be able to feel and look for any changes like lumps, redness, swelling, nipple discharge, lumps under the axilla, any skin changes. So she would be able, she would be the first one to pick up any sign that required for her to go see a doctor. So having breast self-examination on monthly basis is important. Teaching our daughters when they hit puberty that they should be acquainted with their own breast and practice breast self-examination every month. And then teaching the community as well around us. So each one of us could take that message around, and you'll be surprised how many women, they don't know how to do breast self-examination, regardless of all these awareness campaigns and advising them how to practice breast self-examination, videos online, campaigns everywhere. Still, there are still many women who do not know how to examine their own breast. Now, having said that, not every woman has to come up for screening. Only those who have a strong family history or have genetic predisposition, or women above the age of 40, these are the one that has to come up for screening. Other than that, if she practices breast self-examination, she has not felt any changes within her breast, then obviously there's no need to go see the doctor. There's no need to panic. But if she has symptoms, or if which she picked up by breast self-examination, or if she hits the age of 40, she should not only depend on the breast self-examination, she should do another modality, which is the X-ray. The X-ray is different, either a mammogram, either an ultrasound, or an MRI. So there are different forms of X-ray that we offer the patient depending on her age. If she's young, we do an ultrasound scan. If she's above 40, we do the mammogram scan. And if she has implants, for example, we use an MRI for the breast. These type of techniques is just to help pick up something that is still not showing symptoms yet. For example, a small calcification or a small lesion in the breast that is not shown yet. So like if you feel your breast, you don't see any lump. However, if you look on the X-ray, you will, or on the ultrasound or on the mammogram, you would see that first signs of a cancer coming up. And in that case, you would do a biopsy and take further the treatment. It's very important to remind our women in our community to do their examination on regular basis and to do their screening, and not to forget that.
And can I ask you a question? I don't know the answer to this. What are the statistics? If cancer is detected early, breast cancer is detected early, do you have any data to show what the recovery rates are?
Yes, breast cancer, if detected early, has a 98% complete cure rates. So this is whole campaigns of doing breast cancer awareness is to advise women is to come up for the screening. Don't be scared from diagnosis of breast cancer, because once you catch it, you can cure it. Complete cure of 98% if picked up at a very early stage.
What do you think stops women from either doing self-exams or coming in to see you immediately? Because I have a feeling people don't come to you immediately. They don't go to their physician immediately. Something is stopping them. What is that?
Some women would be worried from the diagnosis. Like there is this fear of the word cancer. I mean, we have to admit it. As much as we try to come up and that's why we always say when celebrities come out and talk about their experience, like I'll tell you an example. When Angelina Jolie came up and she said that her mother had breast cancer, her grandmother and her aunt, and she went for a genetic testing, it made an impact on the society. So the society were like, oh, well, Angelina Jolie, she's very beautiful. She's a model. She's a figure. She's an artist. And here she is with fake breasts, but looking as beautiful as ever. So this had made that fear from the disease a little bit less. Kylie Minogue as well, the famous singer in Australia, when she came up and talked about her experience with breast cancer, that as well helped more women get out and screen. Really breaking that myth of cancer being a deadly disease. We have to bring in the right statistics and show people that don't be scared. the more you hide it, you're just upstaging yourself and you're just delaying the diagnosis and therefore affecting your cure rates negatively.
And thank goodness for October being Breast Cancer Awareness Month to help spread that message. So I'm grateful for that. I have a personal question to ask you. When did you know that you wanted to be a physician, and when did you know that this is what you wanted to specialize in? Did you always know this, or did it occur to you somewhere in school?
And I actually discovered my destiny in the States. I've been on the IVLP program, which is a sort of an international visitor leadership program funded by the Department of States of America through the US Embassy. It was just a course about breast awareness. It was a 3 weeks course in different states in USA. So we were taken there. I've had the pleasure of meeting Mrs. Laura Bush, the First Lady at that time, at the White House. And I was introduced on how Americans run about the campaigns of breast cancer awareness. So there was a huge campaign for a charity called Susan G. Komen.
Mm-hmm.
They do the marathon runs on a yearly basis, and they raise funds. And this is back in 2007. So this is like 13 years ago. And when I was on that program, I kind of discovered that this is exactly what I want to do. This is what I want to achieve. And this is what I want to bring home to my country, because we did not have that sort of facility back then. Mm-hmm. So when I first came back to Bahrain, I've decided this is what I want to do. And I'm gonna practice the same way that I've learned in the States and in London. So I opened the London Breast Care Center here in Bahrain, and we equipped it with the state-of-the-art facilities. So we would be able to achieve accurate diagnosis on the very same day.
I have not heard of that myself, and I'm here in the States, and I've at least
there is. I'll tell you that.
I wish I knew where it was. Please, before we go, you tell me where.
The breast services are very well known in the States and in London, and some places in Europe as well. So this is why when I opened it here in Bahrain, this is how I came to win the award, because when I brought it to Bahrain and I opened our Crown Prince, the award was awarded to me by our Crown Prince, and I was applauded for it, because they're like, what a great idea. And I was like, I didn't make it. It's there in the I didn't invent the wheel, but obviously recognizing the gap and knowing that, we are all here to help each other in this world. So whenever you have to find a way to help somebody else, this is the whole motto of us women. And I think also empowering women in doing their checkups and doing their taking care of their health on regular basis is very important.
Well, I think that would be a great question for any woman to ask her physician about the capability of having same-day results to a test. That would be a great question to ask before you ever have an issue, so that you would know. I mean, I personally had one situation. It turned out to be nothing, but there was the wait. They had to do a biopsy, and it was on a Friday. And here in the States, of course, everything closes down on Saturday and Sunday. And so on Friday morning, they called and said, yeah, we found something. Can you come in on Monday? And I said, no, I'm coming in today. And they said, oh, no, you can't come today because we're booked up. And I said, no, I'm coming, and I'll sit outside your door, but I'm not leaving, because I can't go a whole weekend and wonder about this. So please, I'm begging you. And they actually did see me. But if I hadn't been as persistent, they would have not. So I understand that with all my heart and soul. And what a gift you are giving your patients by being able to do this. So thank you on behalf of them.
Other countries, you would be surprised. I mean, you were called in to come in on a Monday, where in other countries it takes about 2 months or 3 months to have their ultrasound scan or biopsy scheduled. So if any other of our guests would share their experience in their countries, if they're aware of that, but usually appointments in underdeveloped countries might take a very, very long time. And that is extremely stressful, and not just stressful, but also upstages disease. Like if she could have been a stage 1 if you diagnose her on the day, but you leave her for an appointment after 2 months and come back to it, it is definitely upstaged.
Amina, did you have something you wanted to say?
Yes, I wanted to talk about my own experience, how I met this beautiful and wonderful Dr. Sara. I had, like 5 years ago, I had also, I went to ordinary October breast cancer month. I went to check up, what is the situation? And I was told that I probably have breast cancer. I was totally down. I really went through a very hard time. And then I went to Dr. Sara because I found her, I don't know, I was checking who is the best doctor and I found her in Bahrain. And when I went to her, and she said, don't worry, everything will be good. And even you have cancer, we will fix it. And she calmed me down. You see, this is so important that you go to the right doctor who will calm you down, even because we all know when there is a cancer, we are all very, very, how to say, down and it is disaster in our life. But when you meet a wonderful doctor who will calm you down and you feel secure and safe in her hands, this is the best. So thank you, Dr. Sara, for this 5 years ago. And even though I went 2 weeks ago also, I felt that I have pain and I went there in the morning and I got checked up within half an hour. So this is Dr. Sara. Thank you so much, Dr. Sara, for all this help and all this kindness what you do for all of us. Thank you so much.
Yes, thank you. I'm always so impressed to see people, especially women like you, who are driven with a mission to make a difference in the world.